My name is Dr. Trudy Ufondu of Snowspirations, Global Health Solutions. Today is the last day of the month of April 2021, and today is a good day. Today is our regular 40s Fridays. Today's clinic is going to concentrate on a very important topic, which so many of our members might likely be going through without knowing. So today we're going to focus on polycystic ovarian syndrome. Polycystic ovarian syndrome. So we're going to look at PCOS, how you can overcome PCOS and at the same time achieve pregnancy. So that's going to be the topic for today's broadcast. Now, this topic is very important because so many people have this diagnosis. So many people don't really understand what it's all about. And so many people are actually above 35. It's something we need to understand properly. So if you have this diagnosis, unfortunately, it's a factor that can stop you from becoming pregnant. So it's something we need to deal with directly. So one of the best things you can do in our group is to acquire knowledge. Knowledge is power. So this afternoon, once I have my number, which is 50, I love 50. 50 is the magic number. Then we're going to have meaningful conversation about polycystic ovarian syndrome. Polycystic ovarian syndrome. So if you have one or few minutes, please quickly join. When you come in, confirm you can see me, confirm you can hear me clearly. I'm going to quickly do one or few housekeepings. Okay, I can see a couple of people joining. I can see Joy. So when you come in, let me know where you're located. I'm located in Tampa, Florida. This is my break time. And today we're going to look at PCOS. PCOS is a factor that can affect your fertility. It's possible you have this diagnosis as we talk. It's possible you're currently undergoing treatment. It's possible you don't even know you have it. So there are a couple of things you need to learn about this, especially if you're above 35. Remember that 40s Fridays is a clinic predominantly meant for women about their 40s. You are going to get to 40s at some point. This will be a very good opportunity for you to deal with your reality. You are not the same person when you're in your 20s. You are not the same person when you're in your 30s. When you get to your 40s, there are some realities you have to deal with. You have to know your options. You have to know the next thing to do. You have to know your own role in your management. You have to have an experienced provider who can show you the way. My prayer for all the women in our group who are in their 40s is for God to multiply and double their blessing for all the troubles. So it's possible you've been waiting for a baby for 20 years. You're currently 45. You're currently 50. God can double your blessings. You can have a twin. You can have triplets. You can have quadruplets. So you can have 15, 20 years of infertility. And when you take your bold step, you can have twins. You have a better chance of having twins when you're in your 40s compared to when you're in your 30s, compared to when you're in your 20s. You have a better chance of having successful IVF with multiple pregnancy when you're in your 40s compared to when you're in your 20s. You have a very big advantage. Now, it's not over until it's over. The only person that knows when it's over is God. So every woman in our gathering who is desirous of becoming a mother will and can become a mother. This is my confession. This is my faith. This is my prayer. It has happened before. It will happen again. You might be the next person to mount the stage and tell your story. You cannot afford to miss this opportunity. So today is a very big privilege for us to fellowship. Let's learn about this particular topic. What's polycystic ovarian syndrome? I have 6 more people before I start. So do me the favor of introducing yourself when you come in. I'm more interested in your location. The reason why I'm interested in your location is because we have a couple of providers in Nigeria. So we need to know where you're located so we can know where to form few alliances. So I have a couple of providers who I trust, who are verified, who are certified, who I can refer you to them. When you go there, they will treat you like a normal person you are, and we can co-manage, and you can have an opportunity to start your family. This is the reason why I show up every day. And it's my belief that by the grace of God, you will be a mother even sooner than you think. So let me know where you're located. And also when you come in, focus on the admin. I have 2 admins in attendance. The Chief Operating Officer, Kenneth, is in attendance. So follow her directives. She's going to help to make sure you get everything you need. The moderator, Chi Evelyn, doing an amazing job. She's in the house. My fellow provider, Dr. Ndiche, is also going to be in the house. So we have a full house. You're going to have fun. Now, if you have any questions, please keep your questions until I'm done with my presentation. Then I can take care of your questions. So I have 3 more people to join before I start. I love 50. The power of 50 is in the ability to multiply 50 by 100, by 200, by 400. So if you love what you're getting from our group, why don't you share it with your friends? I have my number 50. So share our group link, share our group page on your timeline. Invite people to come. It's a free group. You get everything free of charge. Now, if you decided to take your personal history to consult with me, please follow due process. Get a package. Find what you can afford. Is it 1 week? Is it 1 month? Is it 3 months? Is it 6 months? 6 months is the maximum you can come in, and together with God on our side, we'll overcome. So let's get the clinic started. So polycystic ovarian syndrome is a hormonal disorder. So it's something that manifests in the hormones. Hormones are messengers in the body which coordinates virtually everything we do. So in the body of a woman, there are key reproductive hormones: estrogen, progesterone, FSH. FSH stands for follicular stimulating hormone. LH, luteinizing hormone, prolactin, TSH, thyroid stimulating hormones. These are the basic hormones which will help you to become pregnant. Now, every woman has these hormones, but when we begin to have hormone imbalance, when they go up when they are not supposed to go up, when they come down when they are not supposed to come down, you begin to have problems. Your problems can manifest in menstrual irregularities. When you begin to have menstrual irregularities, especially when you are still supposed to have your babies, but you're having menstrual irregularities. What's going on? You are reducing your fertility. So your menstrual irregularities might be an indication that you're not ovulating. Unfortunately, the only way we can tell if you're ovulating or not is to go to the hospital. We take a blood sample, we track your ovaries. You might have all the signs that you're ovulating, but you might not be ovulating. So polycystic ovarian syndrome is a hormonal disorder that causes your ovaries to become swollen and to have small cysts on the outer edges. So in polycystic ovarian syndrome, poly means many. We have many abnormally shaped cysts, fluid containing cysts in your ovaries. Your ovaries are the vehicles that where your eggs that were given to you by God lives. Every woman has 2 ovaries. Inside your ovaries, you have your eggs. Once in a cycle, which is your ovulation, you release 1 egg or you release 2 eggs. When those eggs are fertilized, then the journey of reproduction will start. So in polycystic ovarian syndrome, there are hormonal dysfunction that makes the ovaries to be enlarged. So number 1 thing that happens in polycystic ovarian syndrome is what? Enlarged ovaries. When this happens, it leads to what we call polycystic ovarian syndrome. Unfortunately, we don't know what causes polycystic ovarian syndrome. It's poorly understood. But from fewer researches, there is a combination of a factor from your genetics. So what's your genetics? What your parents gave you. Remember that your father will bring 23 chromosomes, your mother will bring 23 chromosomes, and you will become a complete 46 chromosome. So every individual receives 23 from the father, 23 from the mother to make it a complete 46. Okay? In the same vein, when you get your wife and yourself, your wife will bring 23 sets of chromosomes, you will bring 23, and you will have 46. So every individual is a product of the father and the mother. So there are some genetic materials that your father will give you, and there are some genetic materials that your mother will give you. Guess what? In cost of giving us the good ones, sometimes they give us the bad ones. So we don't know the exact thing that leads to polycystic ovarian syndrome. Now, there are a couple of symptoms which we know can manifest when you have polycystic ovarian syndrome. Number one, menstrual irregularities. So what's menstrual irregularities? You no longer bleed up to 2 days. Your bleeding is just 1 day, or you bleed more than 7 days. Or your bleeding is just all over the place. You don't bleed regularly. This month you bleed. After 4 months, you bleed again. It's just all over the place. Or you have light bleeding, or very heavy bleeding, or painful bleeding. They are all irregularities. So how do you begin to even know about irregularities? You have to know the regular ones. So every woman is expected to know their cycle. Your cycle is the interval between your bleeding days. So if you knew when you bled in March, you can mark the date, then you can count up to April. The interval is your cycle. The regular one is 21 to 35 days. So if you bleed every 21 days, it's normal. If you bleed every 35 days, it's normal. So number one symptom of polycystic ovarian syndrome is what? Irregular menstrual cycle. Number two, excessive hair growth. Now, generally, men are supposed to have hairs. Like you can see, I have my mustache, I have my beard, I have hairs all over my body. There is a pattern of hair distribution for men. There is also a pattern of hair distribution in women. Women are expected to have hairs in their armpits and in their groin. So around the vagina, you're supposed to have hairs. Around the anal region, you're supposed to have hairs. Now, when you begin to have hair distributions as if you're a man, so if you notice, there are some women that have hairs in their faces. That's not the right place to have hairs. I'm not saying that all women that have hairs have polycystic ovarian syndrome. No. Actually, the medical terminology for that is called hirsutism. So number two symptom for polycystic ovarian syndrome is what? Hair distribution as if you're a male. Number three, acne, which you guys call pimple. Remember, when you're growing up, you all have pimples, right? That's then. But if up till now you still have, acne and pimple all over the place, it might be an indication that you might have polycystic ovarian syndrome. Now, the next symptom is what we are actually trying to avoid: obesity. Most women that have polycystic ovarian syndrome, we have obesity problem. Most of them will be overweight, but there are some women that might have polycystic ovarian syndrome and they're like leper. So polycystic ovarian syndrome is not only for women that are overweight or obese. So you can have it and you're normal. The only way we can confirm if you have polycystic ovarian syndrome or not is to do what? To see a gynecologist who will refer you to an endocrinologist. An endocrinologist will refer you to a fertility specialist. So the gynecologist, the endocrinologist, and the fertility specialist will co-manage you to diagnose. So in medical practice, diagnosis is king. Once we can find what the problem is, then we can begin to know what we can do about it. Medical practice is not a blind thing. We need to follow due process. Like I shared this morning, when you're sick, you get a doctor. When you get to your doctor, you tell your story. When you tell your story, your doctor is going to ask you a lot of questions. Your doctor is going to examine you physically. Your doctor is going to send you to the lab. When the lab comes out with your history, with physical examination, we can come out with what might likely be the problem, which is called a diagnosis. So anytime you have a medical problem, please follow the process. Now, thankfully, Polycystic ovarian syndrome can be treatable. So a couple of treatments can include birth control to regularize your period. So some people will be wondering, how can you be giving me contraceptives when I'm trying to be pregnant? I know it's an irony, right? But sometimes, in order to regularize your period, we might give you oral contraceptive pills so we can know the pattern. So don't be worried or afraid when your fertility specialist is telling you to take pills. It's just for a while so we can understand your body. So we can use birth control pills to treat polycystic ovarian syndrome. We can also use a particular drug we normally use in treating diabetes. It's called metformin. This is also a drug that currently it's in use in treating polycystic ovarian syndrome. Now, there is also a type of drug we call statins. So statins can also be used to treat high cholesterol, because we notice that women that have polycystic ovarian syndrome, apart from likely developing diabetes and being overweight, they can also develop cholesterol problems. Now, we can also use hormones to increase your fertility. And in so many situations, if the hairs are really troublesome, then we can treat you and we can go for hair removal. So in summary, polycystic ovarian syndrome is one of the most common cause of female infertility. So if you are told you have polycystic ovarian syndrome, guess what? You can still be a mother, but you need to be properly managed. You can still get pregnant even with polycystic ovarian syndrome. Matter of fact, there are so many people that have polycystic ovarian syndrome, they completed their family without even knowing. Matter of fact, I have a friend when I was in medical school. She had 4 kids. Then after her 4th kid, she began to develop the symptoms of polycystic ovarian syndrome. So the fact you have it doesn't necessarily mean you're not going to have your baby. The majority of women that have it might not be able to have their baby unless they go for treatment. Thankfully, there are various treatment modalities we can use for this. Most women will be able to become pregnant by the time they combine lifestyle modification. So this month, the topic for our Super Masterclass was what? Weight management. Healthy woman. So when you change a couple of your lifestyle, which will help you to be active, which will help you to drop your excessive body weight, you are helping yourself when you have polycystic ovarian syndrome. So besides the fertility drug we are going to give you, when you modify your lifestyle to suit getting your health back, you are increasing the possibility of having good outcome despite having polycystic ovarian syndrome. Now, unfortunately, or fortunately, because anything that happens to us, we always have to see the good in it. So some women with polycystic ovarian syndrome will need IVF. So there are some women that IVF will be your only option, especially if you are above 35. Why do you need to do something different above 35? Because at 35, your chances of becoming pregnant is being reduced because you have fewer eggs, because you have fewer quality eggs. So when you get to 35 as a woman, your game plan towards infertility changes. Your approach to infertility changes. The reason is because, my sister, listen to me. There are so many women that will go into menopause this year. There are so many women that will go into menopause next year. And what happens when you go into menopause? You no longer have eggs. And what happens when you no longer have eggs? You cannot become pregnant naturally. You can become pregnant when you use donor eggs. So what are we doing? Why am I shouting every day? Because I want you to use your opportunities now. So there are some women that might have been having long-term infertility, and the only way they can get pregnant is IVF, and they might likely have 12 eggs. My sister, change your ways. Go for that IVF. You can have twins. You can have triplets. You can have quadruplets. There are so many people that didn't even know they're going to be mothers, and suddenly they are dealing with multiple babies. It has happened before. So if you are above 35, listen to me, my sister. I came with a good news. You can be a mother, but you cannot be a mother if you are not doing the right thing. You have to take action. So if I told you to go for IVF, please go. I know it's expensive. I know it's mind-blowing. But guess what? God gives his toughest soldiers the toughest battles, so you can still overcome despite the cost, despite the difficulty. And if you tried and you didn't succeed, you pick yourself up and you keep going until you hear the cry of baby in your home. You don't give up. And this is a teamwork. So I want the men to be in the forefront. I want the women to be in the forefront. You can still be crying. You can still be complaining, but you are doing something. But just crying or complaining or praying without doing something, it's not an option. It is not an option. What I show up here to do is to show you the way. So I'm telling you today, joy is coming in your homes. Your babies are gonna come, but you need to facilitate this. You need to take actions today. Okay, so I'm gonna quickly go into the various management protocols in regards to polycystic ovarian syndrome. Number one, weight loss. You see, when you are underweight, you have a problem. When you are overweight, you have a problem. When you are obese, you have a problem. The simplest way, which my admin is going to help you in regards to knowing if you're overweight or not, is what we call BMI. So when you plug your weight in kg and you plug your height in meters, weight on top, height below, square, is going to give you what we call body mass index. If the number you got is below 18.5, that's underweight. You're gonna have problems. Matter of fact, women that are underweight will have more difficulties becoming pregnant compared to women that are overweight. Women that are overweight can actually become pregnant and have multiple pregnancies. So you don't wanna be underweight, you don't wanna be overweight, definitely you don't wanna be obese. So when you check your number and your number is below 18.5, that's underweight. We want you to come up. So the normal range is 18.5 to 25. If your number is 25 up to 30, you are overweight. You need to work on it. If your number is over 30, you have obesity problem. You need to work on it. There is absolutely no way you can escape this. Now, when you're getting back your body weight, you're not getting it to make people feel good. You're getting it because when you do this, you're increasing your possibility. So not all women who have PCOS are obese. So many will, but not all women with PCOS struggle with obesity. This is because PCOS, remember PCOS stands for Polycystic Ovarian Syndrome. PCOS will affect your body negatively, especially in regards to how sugar is handled. So there's a particular hormone that handles the sugar that comes into our body. It's called insulin. So women that have polycystic ovarian syndrome, we have insulin resistance. When you have insulin problem, your sugars are not going to be handled properly. Then in regards to that, you begin to add weight. So people that have insulin problem might likely have overweight problem, which can graduate to type 2 diabetes. One of the main reasons why women that have PCOS can conceive is because you don't ovulate. So anything that affects your ability to release the egg, then you have a problem. Without the eggs, you can't become pregnant. So women that have polycystic ovarian syndrome might not be ovulating because they added excessive body weight. But when you begin to work on your overweight, you're likely gonna experience more outcome. Why? A recent study discovered that women with polycystic ovarian syndrome will likely have what we call anovulation. So some women can be bleeding. The fact you're bleeding every month doesn't mean you're ovulating. So some women can be bleeding and every 4 months they will be ovulating. That's a problem we need to correct. When you correct your body weight, you have possibility of bringing back your ovulation. According to a particular research, about 5% to 10% of current weight problem, once you lose your weight and you come back to your normal weight, about 5 to 10% of women that have this problem will recover their menstrual cycle, will recover their ovulation. Unfortunately, we don't have much evidence, but what we know is the fact that when your body weight is normal, you're increasing the ability of becoming pregnant. Now, in some situations, when you do this and when we combine it with fertility drugs, you have a better chance of becoming pregnant. So what am I preaching? Work on your body weight. Research found that women who lost body weight have a greater chance of having good outcome in fertility treatment. So when you lose your body weight, you have a better outcome. When we give you Clomid, you can have good outcome. When you go for the IUI, you can have good outcome. When you go for IVF, you can have better outcome. When you go for surrogacy, you can have better outcome. So what am I saying? When your body weight is underweight, overweight, or obese, you will have poor outcome. Now, nobody is going to lose your body weight for you. You are the only person that will lose your body weight for you. So this is not the one that prayer is going to help you. Today, I resume my workout. So the problems you guys have, I have it. So there are some days, there are some periods, a lot of things will be in your shoulders, in your mind, and you don't get to do what you need to do, but you need to do it. I have to lose my own body weight. Nobody's going to lose it for me. So you need to work on your body weight. Losing weight will make it favorable and easy on your body and will be able to help you to overcome your inability to become pregnant despite the fact you have PCOS. Now remember, not all women with PCOS have overweight problem. So if weight issue is not your problem, then likely losing weight might not be the problem. Now what's the next thing to consider? Your diet. We overall become what we eat. The reason why we add a lot of body weight or we don't have normal weight is because of what we eat. 80% of our body weight is determined by what we eat or what we don't eat. So your diet is very important. You must eat very healthy. Healthy diet is very important in management of PCOS. So when we are giving you those fertility drugs, you have to go back and you have to start eating. There is this partial difference, partial increase in your body's ability to normalize the insulin. Remember, insulin is the hormone that regularizes your blood sugar. When your insulin is not performing its role, then your body will begin to retain those sugar and you're going to be predisposed to developing diabetes. But when you're eating properly and you're exercising, what's going to happen? There will be difference. There will be changes in your body. So people will be asking, is there a particular diet that is actually going to be very, very, very helpful for PCOS? It's a very, very difficult thing to say. So it's a matter of debate. But some studies claim that when you have low carb diet, it's actually going to be good for you. But we haven't really substantiated this. Remember, in medical practice, there are so many things we call hypotheses until it's tested and it's seen as an evidence. Then we can go about and start preaching it. But some people believe that low carb diet will help you to do this. But what we understood, when you form the habit of eating highly processed food, when you form the habit of eating junk food, so what's junk food? All those Mr. Bigs, all those McDonald's, all those foods you eat outside your home. So for women that want to become pregnant, the best food to eat are the food you prepare for yourself. Because when you go to Mr. Bigs, when you go to KFC, when you go to all those places, the food might be tasteful, but you don't know how they prepared it. You don't know the quantity of calories. But when you stay back and you prepare your own meal, you can control what you eat. So form the habit of eating your own prepared meals. When you do this, you're going to avoid junk food. So avoid your cake, avoid your ice cream, avoid your pizza. Make sure you eat what you prepare. If you are looking for a baby, we become what we eat. 80% of the reason why you don't like your body weight today is because of what you eat or what you don't eat. 20% is lack of activity. So if you can eat properly, you might not even exercise and you'll be okay. That's a fact. Our problem is what we eat. So work on what you eat. Now I'm going to give you fertility-friendly eating tips. Eat healthy fruit, veggie-based breakfast and dinner. Don't skip any of your meals. You need all the food items, but you need them on specific quantity. Remember, if you attended the SUPERMASTERCLASS, the guest presenter gave us a lot of insight. So you're not supposed to avoid any meal. So long as they are eaten in right quantity, that's what we eat. So remember to include your proteins and green. So anywhere you see green, embrace them. Embrace your fruits, embrace your vegetables. They will help you. When you are eating your carbohydrates, make sure it's complex carbohydrates like whole grains and your beans. Complex carbohydrates can easily be handled. When you are eating food that contains high carbs, combine them with healthy fats. So things like avocado, things like olive oil and nuts, they are very healthy. So what am I trying to say? Make sure that your diets are balanced. You have a better chance of having good outcome when your diet is balanced. Exercise, I've already emphasized on this. Find the exercise that will make you to sweat. Lately, I noticed that talking is my form of exercise. You can see I'm sweating because my home is cold. So find an exercise. Regular exercise can help you in mitigating PCOS symptoms. Matter of fact, in one study, a combination of regular brisk walking. You see, walking is one form of exercise we neglect. Dancing is Friday. Wear your headphones, play your best music. Even if you don't know how to dance, jump up and down. It is exercise. Don't be in one place and you're gossiping. You can still be gossiping and you're exercising. This morning I was consulting and I was in my treadmill. So you can combine a lot of things. So for any reason, get up and do something. If it's cold, run your staircase, do push-ups, do planks. There are so many things you can do with your body. But please, if you have PCOS, exercise is a must. Whether diet or exercise alone can help you isn't clear, but a combination of diet, exercise, and the medications I'm going to talk about will help you to defeat polycystic ovarian syndrome. But when you do nothing, you are risking not becoming a mother, not because you can't become a mother, but because you're not doing the right things. Healthy lifestyle may help your fertility treatment work better. So what am I trying to say? When you are going for a very expensive procedure like IUI or IVF, please don't go there overweight. Please don't go there with obesity, because guess what you're going to have? You're going to have what we call DOA, dead on arrival. In the same vein, when you're going to spend a lot of money for assisted reproductive technique like IVF, please don't go with big fibroid. You are going to start something that will fail even before you start. Be battle ready. Make sure your wound is empty. Make sure your body weight is okay. Make sure you're sleeping properly. Make sure you're avoiding stress. The problem, the stress we undergo in regards to looking for a baby can overwhelm our body. And the body of a woman is very sensitive. Any slight stress in your body can disrupt your cycle. So you must learn how to relax. Relaxation is key. I don't know how you're going to understand this, but some people are not sleeping in the night. Some people are freaking out. Some people, their blood pressure is high. Some people do not have problems. Some people's libido is gone. Why? Because you're stressing all over the place. And when you're stressing, what do? You look for comfort in food. You begin to eat the things you're not supposed to eat. When you stay up in the night and you're not sleeping, where's going to be your best friend? Your fridge. Some men will start drinking alcohol and you begin to make an already bad situation worse. So please, let's be careful. When you lose your weight, you have a better chance of becoming pregnant even with your own, without taking anything. There are some people we gave, go and prepare for IVF, but they went back home, they started practicing PPP and they became pregnant. So regardless of your diagnosis, my admin, please capture this. Regardless of your diagnosis, don't stop your PPP. PPP is where God can meet you halfway. PPP is the biggest miracle that God has given us. If you don't know the meaning of PPP, the first one is praying. We pray a lot. Silent prayer, loud prayer, I don't care what it is. But pray as if your life depends on it. Because guess what? The reason why you're hearing my voice today is because of prayer. So we pray a lot. Now, when you have said your prayer, you have to play every 48 hours. So men that have low sperm count are actually advised to increase the frequency of their lovemaking. The fact you have low sperm count doesn't mean you can't get your wife pregnant. But when your sperm count is 0, then you need help. So if you are having problems, increase your frequency, because you always have a chance of becoming pregnant on your own. Don't go and stay in the guest room and your partner will be in the main room and you're complaining you are not able to have a baby. You are not doing the right things. You cannot become pregnant without your partner. You need each other. So settle all your quarrels. Come back home. Okay, so I've talked about a couple of things you can do. Now, what are the medications we use in treating this? I've already mentioned metformin. Naturally, metformin is used for treating diabetes, but for some reasons, lately we've started using this to take care of women that might likely have insulin resistance. So number one, medication we use in treating polycystic ovarian syndrome is what? Metformin. When you are on metformin, it can help you to promote weight loss, regain your cycle, improve the effectiveness of fertility drug, and reduce the rate of miscarriage. This is very important. There are some women that have been having miscarriages. You do not want to become pregnant and you lose your baby, for things we can prevent. So please work on this. So when you are on your metformin, it can help you to lose body weight. It can help to regularize your period. It can help with the effectiveness of other fertility drugs. And it can also ultimately reduce the chances of having miscarriage. Now, can metformin work alone? No, not likely. We have to combine metformin, exercise, and eating properly for it to have a chance. The other drug, which will actually make you happy, Clomid. Clomid is the most commonly used fertility drug all over the world. It's commonly also used in treating PCOS, your almighty Clomid. But guess what? You are not supposed to use Clomid unless you use it. So the fact I mentioned that Clomid is one of the drugs that is used, don't go start treating yourself. You should never in your life take any drug without seeing a doctor. It doesn't make sense. This is the reason why I will be the last person to tell you to take any drug, because I haven't seen you one-on-one. I don't know your medical history, and I won't be helping you. So we don't prescribe drugs in this group. We connect you to a doctor that will find out the drug you use and make sure it's regularized. Clomid works in women that have a need for it. Capture this. Clomid can work in women that have Clomid need. So if you are having ovulatory problems, if you have polycystic ovarian syndrome and you are not ovulating, we can give you Clomid, guided Clomid administration that can help you to ovulate, because once you ovulate, you can become pregnant. Unfortunately, Clomid is not successful for everyone. There are some women that will have what we call Clomid resistance. So what's Clomid resistance? When you take Clomid to trigger your ovulation and it's not working, then it's called Clomid resistance. When you have that, we understood that when we combine metformin and Clomid, you can have a better outcome. Now, some women might not respond favorably to metformin or Clomid. Now, there's another drug we can give you. This drug originally is used in treating cancer. Letrozole. We formerly use it in treating cancer. So this drug lately is being used in treating polycystic ovarian syndrome when Clomid is not working, when metformin is not working. Some providers can use this particular drug in treating polycystic ovarian syndrome. So what's the other one? Gonadotropins. Gonadotropins are hormones that help your body to function properly. So when Clomid or letrozole is not successful, we can give you injectable fertility drugs called gonadotropins. Gonadotropins are artificial FSH, follicular stimulating hormone, and LH. These are the hormones drug we give you when you're going for IVF. So any woman that is going for IVF, most of those injections we give you to make sure your ovaries are producing eggs are actually gonadotropins. Artificial LH, artificial FSH. We can give you alone or we can combine it to increase the possibility of you ovulating. Once you can ovulate, then you can begin to have a chance. Now, in some situations, we can combine injectable gonadotropins with IUI. In IUI, what do? We collect washed, very healthy sperm. We deposit it inside the womb. Then it can begin to go to where it can meet the eggs. So in IUI, intrauterine insemination, which is also called artificial insemination, we are going to use a special catheter. We're going to put washed sperm inside a special catheter. We introduce it into the vagina, pass through the cervix, get into the womb. We deposit the sperm in your womb. Now, by the time we deposit it in the womb, then the sperm will begin its upward journey to the tube. So if we target the time you're going to release your eggs, then we're going to give you that sperm. Then the sperm is going to help you to become pregnant. Now, unfortunately, some women can have adverse effects which we call hyper-ovarian stimulation syndrome. When your ovaries are very, very angry, they are swollen, they are very painful, we can stop that treatment. So one of the side effects of taking gonadotropin is what? Ovulation hyperstimulation syndrome, OHSS. If this happens and if it's not treated, it can be deadly. So if you're going through IVF treatment and they ever told you have this, we can suspend your treatment and we can look for other things. Now, what do we normally do? We give you very low dose drugs. My people, listen to me carefully. The same drug we are giving you to help you to become pregnant can cause cancer. Are you listening? Hello? The same drug we are giving you when you're coming for IVF, if it's not regulated, if you are a Nigerian that love abusing Clomid, that love abusing Postinol, you can develop cancer. Listen to me carefully. The only people that should monitor gonadotropins and fertility drugs are fertility specialists. We know the quantity to give you. We know when to tell you to stop. When we tell you to stop, please stop. When we tell you to continue, please continue. But never take your Clomid without due process. Please don't take your Clomid without your doctor's instruction. Very, very important. Now, some women, like I mentioned, can use IVF. If every other thing fails and you have polycystic ovarian syndrome, then you need to go for IVF. In IVF, the same thing. We give you a couple of drugs to go to your ovaries, to mature your ovaries, get the eggs, get the sperm, get them together in a lab, then put them back into your womb. So some women that have polycystic ovarian syndrome will also need IVF. Okay? Now, some women might have this ovarian hyperstimulation syndrome. So what do? We collect the unmatured eggs from your body, then we put it in the lab, then we mature it in the lab. It's called in vitro maturation. Now, some women can also use donor eggs, but most women that have polycystic ovarian syndrome can become pregnant by themselves. But women that have already advanced in age and your ovarian reserve is also low, then you are advised to go for egg donation. But if you don't have a need, you can defeat this problem. The fact you have polycystic ovarian syndrome is not the end of the world, but you need help. You need a fertility specialist, you need an endocrinologist, you need a gynecologist. So these three teams of doctors are going to help you to become while you're working on your body weight. Okay, so that's my presentation this afternoon. And I'm going to give us an opportunity to ask our questions. So the clinic is going to open now in next 15 minutes. Unfortunately, I had a lot of things to talk about, but you have 15 minutes. Okay, you have 15 minutes to ask me your questions. So please go ahead and ask your questions. Follow my admin. If you need help, you can get help. This is Fortis Fridays. Everybody's welcome. So the clinic is going to open, and please ask your questions. If every other thing fails, don't stop your PPP. Pray every day, play every other day, and practice every day. Admin, capture this for me. Pray every day, play every other day, and practice every day. Let me repeat. Pray to God every second in your life. Play every other day. That means love making 48 hourly, then practice every day. If you can apply triple P, you don't even know. There is nobody born of God and made a woman who was born barren. No, not even one singular person. So by the time you understand this, then you can walk tall like the daughter of the Most High God. Guys, ask your questions. Okay? The person sharing her medical report openly, it's against the rules of engagement. Please don't share your lab reports openly. It's unethical. It's a breach of your privacy. If you need consultation, come in. You can come in at 1 week. You can come in at 1 month. You can come in at 3 months. But you can divide your family. Imagine yourself going to the whole world. Remember that Facebook is the whole world. 2.6 billion people. You go to the whole people, you tell them that your husband is impotent. You're not going to go back happy. Your husband is going to fire you. You don't want to treat your medical issues up, even if it's malaria. Don't put it out there. Learn how to be careful in social media. Okay, so please, if you need help, I'm going to help you, but you need to subscribe, okay? But please just ask generic questions. Don't put your medical reports out there. Okay, what's the difference between PCOS and ovarian cyst? Polycystic ovarian syndrome. Now, polycystic ovarian syndrome is a type of cyst. Cyst is an abnormal growth in the ovaries. So there are different types of cysts. You can have simple cyst, you can have chocolate cyst, you can have a couple of other cysts, dermal cyst. So they are abnormal growths in your ovary. So polycystic ovarian syndrome is a type of ovarian cyst. You have PCOS. They prescribe metformin, but the side effects were unbearable, then you stop it. Can you start again? My sister Pace, if you were following me, I'm not the person that will tell you to stop or start. You go back to your doctor. Anytime you are given a drug, there are a couple of things the drug will do. They can do the right things. If you notice, when we were little, we used to take chloroquine, right? I'm one of those people that can't take chloroquine. I can itch for the whole Africa. But guess what? When I'm itching, the chloroquine is working. So you can be itching and the chloroquine can be working, but that itching is the side effect. Now, some people can have adverse effects. So when your provider gave you a drug and you're responding with, like people that have typhoid and a couple of other things, you know, it comes with big headache. So every drug you're taking can have side effects or adverse effects. What do? You go back to your doctor. You don't stop or increase a drug by yourself. That's not good practice. So please, you need to go back to your doctor. Okay, let's continue, guys. Is letrozole effective in managing PCOS? I mentioned it as one of the drug of choice. Originally, is a drug we use in treating cancer. So yes, if your doctor prescribed letrozole for PCOS, that's a drug we also use in treating polycystic ovarian syndrome. Someone had a ectopic pregnancy. What are her chances of getting pregnant? Unfortunately, when you have a ectopic pregnancy, that side of the tube is damaged. So you now have one tube. Can you still become pregnant with one tube? Yes. So long as that tube is open and healthy, you can become pregnant with one healthy tube. Unfortunately, if the two tubes are blocked or damaged or removed, then you need to go for IVF. Okay, let's continue, guys. If labor comes naturally at 36 weeks, is there any cause of alarm? So when you go into labor before 37 weeks, 37 weeks is term. When you go into labor before 37 weeks, it's called preterm labor. Now, you have to make sure that the hospital where you're using has facilities to take care of a newborn. It's called neonatal intensive care unit. So any baby that comes before 37 weeks is termed preterm baby. Now, unfortunately, some babies might want to come early. So if your baby is coming at 36, if you're going into labor at 36, what are we going to do? We're going to admit you to the hospital. We're going to try and see if we can abort that labor. But if the labor continues, you're going to have your baby. But when you have your baby, we're going to take your baby away and make sure that your baby is okay before you go home. So this is why you need to be careful with your pregnancy. So I don't know if you're in our ANC group. If you're in our ANC group, these are the kind of things you can benefit from. But 36 is a far cry. You have one more week to get to 10. But you probably have 4 or 5 more weeks before you get to your EDD. EDD is the expected date of delivery. But when your baby is tending towards 37, once a baby gets to 37, when that baby is born, the baby is okay. All right? Your question is about COVID vaccine. A woman planning to go for IVF, is it advisable to take it 100%? 100%, even pregnant women. Depending on your doctor's opinion, some pregnant women took the vaccine. So if you're planning to go for IVF, definitely, if you're a high-risk group, definitely you should take it. There are so many people that took the vaccines that are doing okay. All right, so go and take it. Okay, all right. How many weeks can triplets pregnancy last? So here's what I know. Any woman carrying more than one baby will likely deliver around the neighborhood of 34, 35, 36 weeks. So if so many of you are planning to have multiple pregnancy, you're not likely going to get to your EDD. The more babies you're carrying, the more you're going to have early delivery. So babies that are going to be twins are likely going to be delivered around 36. Some might be lucky to be delivered around 37 weeks. But it doesn't matter. If babies are going to come early, we're going to take care of that. Okay? So the more babies you're going to have, the earlier you're going to have your babies. Okay? All right. Okay. Ovumine and Clomid are not the same. Okay? They're not the same. Okay. I have a few more minutes. You had miscarriage in February. You had evacuation in February. Your period never came until 17th of April, and it lasted for 3 days. But you still notice breast milk each time. You're completely okay, my sister. You're going through changes. Your body is adjusting. You don't have no singular problem. Allow yourself to recover. February is just around the corner. That's February, that's March, that's April. So the fact your period came back and lasted for 3 days is actually a good thing. Anytime you're bleeding for 2 days, that's a lower limit of normal. Upper limit of normal is 7 days. So 3 days, completely okay. Now, the reason why your breast is still expressing milk is because previously your breast was getting ready to feed your baby. So it's not unusual to still have breast leakage when you've had miscarriage. Completely okay. So you don't have any problem, Kelechi. Okay? Okay. What's the cause of miscarriage at 2 to 3 weeks all the time? Likely chromosomal abnormalities. The most common cause of miscarriage is chromosomal abnormalities. Now listen to me carefully. This is when you need to stop. Anytime you've had consecutive miscarriages, which we call recurrent miscarriages. So if your last 3 pregnancies ended in first trimester miscarriage, remember, miscarriage is the unintended loss of your baby before 20 weeks. If you lost your baby beyond 20 weeks, it's called stillbirth. So please, any woman who experienced miscarriage, when you have cried about it, go back to your doctor. We need to investigate. We need to make sure that all the remnants of your baby is completely removed from your body. Some people can express it by themselves. Some people, we can give some drugs. Some people can go for evacuation. For whatever reason, whichever one that needs to work for you, please go for it. Okay? Is aspirin safe for pregnancy? Yes, if it's indicated. Some pregnant women can be prescribed aspirin, okay? It's protected. Okay. Okay, please, how will one know that the left tube is blocked? You go for HSG, hysterosalpingogram. It's a special X-ray we can use to check the state of your tubes. Okay, let's continue, guys. Keep asking your questions. Let's actually wrap up. We have 5 more minutes. Okay, ask your questions. Ask your questions, please. Okay, let me go down. Let's see what we have. It's ovarian cyst treatment the same as ovarian cyst is a broad spectrum terminology. Pcos is a type of ovarian cyst. Okay? All right. Someone had miscarriage at 16 weeks. When is the best time to conceive again? So like I mentioned, when you have miscarriage, it's always good to piggyback to your doctor. We need to investigate. We need to make sure we remove the remnants of your baby. So we don't want to have what we call retained product of conception. So anytime your baby is no longer viable, we want to remove all the contents of your baby from your body. So you need to go back to your doctor. Your doctor will know when you're good to go. Don't be in a hurry. The problem is some women are much in a hurry to become pregnant, to prove to their partner, to prove to the whole world they can become pregnant. They begin to lose the baby again. When you've had a miscarriage, we want to know why. So we can do what we can do. Some women might need to go for sacrilege. Some women will need to tie their womb to reduce the possibility of losing your baby. So we need to do what we need to do. Okay, let's continue, guys. Let's continue. Please ask your questions. Let's wrap up. Okay. How soon can you go for the second cycle after failed IVF procedure? First of all, we want to know why it failed. So what you should be asking for is the report. Every woman that went for IVF, whether you succeeded, whether it failed, request your report. We need to review. Why did they fail? What can we do differently? Can we do this better? Can we do that better? Then if you have remaining eggs or embryo, you can go for a second chance. So let your doctor be the person to make that call. Okay? What's the cause of failed IVF? It can be the egg, it can be the sperm, it can be the ovule, it can be implantation failure, it can be structural problems, it can be infection, it can be hormonal issues, it can be anything. Okay? What's the cause of a young lady in her early 30s not menstruating for over a year? It's possible you've gone into premature ovarian failure. Anytime you haven't bled for 12 months, we are worried. If you are above 35 and you haven't bled for 12 months, it's likely you've gone to premature ovarian failure, what we call early menopause. Any woman that hasn't bled for 12 consecutive months, we are worried. We want to know why. Okay? All right. Anytime you're having any discharge from your vagina that is not clear, that is not smelly. So colored, copious, itching, smelly, vaginal discharge, there's a problem. You see a gynecologist. Okay, guys, one more question, then I'm done. How do you know you have endometriosis? Is a diagnosis your gynecologist will make, so you need to see your gynecologist. Okay? All right, guys. Okay, guys, my time is up. Keep it there with me tomorrow for my word round. And thank you for coming. Please do the right things. If you have need for help, we can help you. So if you need to consult with me in regards to your medical case, follow the admin. You can come in at 1 week. You can come in at 1 month. You can come in at 3 months. You can come in at 6 months. So I love you guys and thank you for coming today. God bless you and bye-bye for now.